Hey, everybody, welcome back to the CONVO Couch. I'm here with a special guest from Wisconsin, Dr. Richard McGowan. Richard, thank you for being here today.
Thank you for having me.
I know this is a very busy time for you. We're experiencing an unprecedented pandemic, one of the most unprecedented, also economic crisis of our time. And I know that as a doctor, you are incredibly busy. Give us a snippet of what's happening right now in Wisconsin, not only in your hospital, but related to obviously COVID-19.
Sure. Well, I think what's happening in Wisconsin right now is really mirroring what's happened in the rest of the country. Um, we have fewer case numbers, but our case numbers of people affected by this virus is growing every single day. I think today we have over 2,100 cases. We've had 56 people die from the virus, at least 56 people that we can directly attribute to the virus.
Right.
We may have had more. About a little bit over a quarter of the people that have been infected here have ended up in the hospital. Uh, in the county that I live in Dane County, which is where the capital, Madison, is, we've had 250 cases and we've had about 5 deaths. So we're seeing the same trend as the rest of the country. And I think as a physician, I can speak to my experience. I think it's pretty similar to as to what I've read is going on in other states and other communities,
Mhm.
um, and it's what's mirroring the experience of many healthcare workers, especially nurses. Uh, Everyone that's on the front lines of this is kind of going through the same thing. There's been a complete disruption in the normal routine in healthcare as we know it. So my hospital, the entire focus has been directed at COVID-19 patients. How do we screen for them? Where do they go in the hospital? Once they've been identified, what precautions do we take to protect the patients that don't have it? Even after we've ruled them out for the virus, how certain are we that they don't have the virus, and when is it safe for them to go somewhere else in the hospital or go home? It's changed everything about medical care. As a result, it's an exhausting process. So a lot of us are going through the same thing, and everyone's kind of as a healthcare, all the healthcare workers and physicians and everyone that's directly involved, we've all had to step up and sacrifice and put ourselves at risk. And I think everyone's kind of feeling that at the same time.
Do
So
you feel like you guys have a good PPE?
you've identified that as an issue.
Yeah.
I can speak to my experience in my hospital. Right now, it seems like we do have adequate PPE, but we're already at the point because in Wisconsin, we haven't seen what they call the surge or the peak of the number of cases
Yeah.
that we're predicting we're going to have to start rationing much more
Okay.
than we have. And right now, we're actually trying to reuse masks and um, uh, kind of keep the PPE directed toward only a certain number of patients. And in the future, it doesn't seem like that's going to be possible because we're going to need much more of it. There's going to be more cases. And based on our current supply, we're probably going to have to ration it. And
Right.
we've seen that already much more significantly, like in New York and other more populous states. But I think the same thing's going to happen in Wisconsin.
Right. Yeah, that people are getting their peaks at different times. We're not at the peak yet here either till the end of the month in California.
Right.
But how are the doctors feeling about how the government is handling this? And what about families? How are families and patients feeling? Do they feel secure or do they feel
Well,
insecure?
I think I'll speak to the families first. I think it's not a mystery to anybody that it's caused a grave amount of anxiety amongst the entire United States. I mean, people are fearful of contracting this virus. There's a lot of unknowns about even how it presents. There's a lot of variability in what the disease looks like, and there's a lot of variability in how sick people get. And we're seeing people obviously with mild symptoms, but we're also seeing people get very sick and in horrible cases die. And people understandably are concerned about this. And this is all in the context of also this massive economic crisis. People are losing their jobs, many of which are tied to their health insurance status. So they're worried about getting sick in the first place. and that just causes a severe amount of anxiety and fear in the population. And I can tell you that my own patients have expressed that as well.
Yeah. And you seem to be obviously a concerned critic regarding the upcoming Wisconsin primary this Tuesday. How do you feel about what could happen health wise if people are allowed to go to these polling locations, or made to feel like they either have to choose between going to vote and enacting their democratic right, or making sure they abide by the CDC and by the stay-at-home protocol?
That is a significant concern, and in fact, I actually felt motivated a couple days ago to make a video and put it on Twitter, something that I've never done before, to call out our government's lack of response to this issue. On the 24th of this past month in March, our Governor Evers, issued a shelter-in-place order. He calls it Safer at Home, which closed down non-essential businesses and strongly recommended the public to remain indoors, minimize social interaction, basically extreme social distancing. And our state has had high compliance rates with that order, actually better than average compared to some of the other states who've issued the order.
Yeah.
The issue becomes that our election is just around the corner. As you said, it's next Tuesday on April 7th. And holding the election as it stands puts potentially numerous people at risk of contracting this virus, spreading this virus. We know that voters on average tend to actually be older people. That's who we have a higher turnout of in this country in terms of voters. And they're the exact people that have been warned to avoid this virus at all costs because their risk of getting sicker is much higher. Wisconsin, like a lot of the United States, has a lot of people with chronic diseases, diabetes, obesity, heart disease, lung disease, the exact conditions that people, if they have them, should avoid being in populated areas. Because of these fears, we've already seen a giant drop off in the people that usually volunteer at the polls. So people are dropping out. They're saying, I'm not going to come. And different cities have seen extreme reductions in the polling locations. For example, Milwaukee went from 180 polling locations to 5 for Tuesday. So, it's not a mystery to what's going to happen. Those polling locations that are open are going to see a lot of voters in a short amount of time, in a short amount of space. And if you look back and see what happened in Florida and Illinois and some of the Super Tuesday states, and afterwards, or the second Super Tuesday, people got sick. There was a spike in COVID-19 cases after they held the election. And those governors and those governments made the wrong decision to proceed with that election. And so I think that our governor needs to declare a public health emergency, as he already has, essentially, but invoke it in reference to the election and postpone the primary.
Yeah, because he has the power to do that, correct? He has the power to do that.
It's controversial, or it's ambiguous. The legislature says that he doesn't. It takes an act of the legislature to declare that. Multiple lawyers have cited a state statute that says that he does have the power to do that. And we, as concerned citizens, would like him to do everything in his power to try to do that, even if it risks incurring a lawsuit or contention from the Republican legislature, because we think the risk to the public is much higher than it's being addressed right now.
Exactly. So going off of that, what do you think of the way our elections are run right now? And specifically, what do you think about this primary thus far?
I think that we've seen issues this year, as we have during multiple elections in the past, problems with voter disenfranchisement and voter suppression, closing of polling places, kind of all over the country. And we've seen that during prior elections, and I'm disappointed in that. And that's obviously a major issue that needs to be addressed. But then adding the virus to the mix, kind of what we just talked about, I think that holding the elections in the same traditional way that they've been done before doesn't make a lot of sense until we're past the peak of this virus. And I think that we need to do a lot of work to both preserve our democratic right to vote while also not threatening our public health and trying to heed the recommendations of the CDC and Dr. Fauci and local state leadership in public health, trying to prevent the greatest number of deaths and cases as possible from this virus.
What do you think about vote by mail?
I'm in support of it. I will say that I think that our state has one of the things that Evers has called for, the governor has called for, is to make it an all mail in election, mail in ballot election. And they were supposed to meet today, but they didn't. The legislature refused to really meet with him, but they're supposed to reconvene on Monday to talk about that. And I would be in support of that, but I think I would like to see even more, because not everybody likes to vote absentee. Some people like to go to polling locations, at least the option of them returning to the polls when it's deemed a safer option.
Yeah.
And perhaps that's not an option, but I think time will tell.
Yeah. Do you think this pandemic is going to last? And how bad could it get, in your personal, professional opinion?
I do. I think the pandemic is going to last. I think there's no evidence that it hasn't peaked in this state. It hasn't peaked in the majority of states right now. And if you look at CDC projections and a variety of other projections, it looks like it's going to go on for several weeks to several months. And there's a lot of uncertainty, and it depends a lot on if we continue to heed the social distancing recommendations, but it also there's unpredictable variables as well. So I think time will tell. We're in the healthcare field, we're all kind of directing all of our resources right now to helping the people who've already gotten sick, but we're looking for more guidance and for more evidence on how to prevent people from contracting the virus. At the same time, we're also looking at potential treatments which are in the works. There's clinical trials that have been going on now for a very short amount of time, just several weeks. And so there's just a lot of uncertainty what's going to happen with the pandemic.
Regarding the Wisconsin primary, what can people do to raise awareness, not just in Wisconsin, but maybe outside of Wisconsin, to try to stop this primary from happening? Obviously, it would endanger the lives of many people.
That's a good question. I'm a little bit out of a loss. I think that the most effective thing right now would be, as a constituent, as a voter, to make your voice heard. You can call Governor Evers. You can call his office. You can email him. You can email members of the legislature, including Robin Voss and Fitzgerald, and let them know that you're not happy about the idea of proceeding with an election at this time. And hopefully a public pressure campaign does something to change this. Otherwise, I've wondered about if poll workers just decided not to show up and they held a strike, if that would send a strong message. I don't know if I fully support that idea, because if people do go to the polls and there aren't any poll workers, then that could perhaps cause even more dysfunction.
Yeah.
So there aren't really good, clear answers. I wish that the governor would take a stand and do the right thing and just postpone it. And then I think the issue would actually be solved for the time being.
So many people are rising up. We've seen Amazon workers, Instacart, and rent strikers. You just attended a protest. People are rising up and starting movements, but things are falling apart also. And it seems that because things are falling apart, we're seeing people become more aware because they're directly affected, unlike they were before. Before, there was the progressive movement and the progressives that were aware of all these things happening, not having healthcare, etc. But once this pandemic came, other people are directly being affected by not having healthcare, by not being able to pay their rent because they've been laid off.
Right.
What actions can people take amidst the pandemic, as far as, how to push the movement or push these sort of working class issues that have risen up and more so become prominent as a result of this pandemic?
I think make their voices heard. And I'll express my personal view. I'm a strong supporter of Bernie Sanders' presidential campaign, specifically the issue of Medicare for all, universal health care, single payer health care. I think that we need to remove the profit motive from healthcare and remove its ties to employment status, and make it so that every man, woman, and child is allowed to receive healthcare without incurring massive debt, which just creates this fear in people and does a lot of damage. It prevents people from seeing doctors on a regular basis. So we have a chronically sick population because they don't see physicians. They're not screened for these disorders or treated for them. And right now we're starting to see evidence of what happens when there is a national health crisis, a pandemic, how that unmasks those issues.
Yeah.
So I would say that people should get behind that movement. And whether that includes voting for Bernie Sanders, if your state still hasn't voted yet, that's something that I'd strongly propose if you can get behind him, or just lobbying on a local, state, national level for universal health care and that sort of thing. Yeah.
Yeah. So since we have you here, what advice do you give to people so they maintain, other than staying at home, so they maintain their immune system, so to do anything that they could do to avoid getting COVID-19?
I think it's a lot of common sense advice. So if you're already following the CDC's recommendations and washing your hands and avoiding close social contact and wearing a mask, apparently now everyone's supposed to wear a mask, which I would get behind in public. If you're doing all those things already, I think the other things are making sure that you're sleeping. If you have medical conditions already, making sure you're taking the medications you're supposed to be on, so you're not getting decompensated chronic medical conditions, and trying to stay as healthy as you can. Exercise, eat as well as you can. A lot of these things are hard to do when you're already in debt or have economic insecurity, and so there aren't great answers. But
Yeah.
that's what I would advise.
Do you know anything about the cocktail of drugs that have been put out there to kind of that people are taking? There was Tamiflu was mentioned, a drug with hydroxychloroquine. That's what it is. Yeah. Do you know anything about that, or how close people are to finding a cure or a vaccine?
Well, so the medications you just listed, neither of them are thought to. They're not going to be a cure. They're like a supportive treatment, and there are clinical trials going on right now. They're basically being used off-label. Tamiflu is used for influenza, and hydroxychloroquine is an anti-malarial drug. I myself have used hydroxychloroquine. There's like I said, the clinical trials are only now about a week old. They just started. And so we don't have great evidence that they're doing anything. We're using them in a subset of patients. We're not using them for every patient that has this virus, but only patients who don't have enough oxygen. They're hypoxic. And anecdotally, it seems to help people do better clinically. But again, we don't have strong evidence. And then in terms of a vaccine, I'm told that the studies that are being done and the work that's being done is months in the making, and they're projecting a vaccine's available in approximately a year. So
wow.
A lot of the public health recommendations are going to end up being much more important than even some of the medications and treatment in the meantime. And that's the problem with viruses and pandemics, is that often there aren't great treatments.
Yeah, they just take a while. Thank you so much for being on here. I appreciate it. We appreciate what you're doing as a doctor, as a concerned citizen. We're going to keep reporting on Wisconsin all the way till Tuesday. Hopefully we don't have a primary, because that is ridiculous to me. But thanks for what you do. I really appreciate you.
Yeah, thank you, Fiorella. Thank you.
Nice to meet you. Bye-bye.